The four-chamber view is probably one of the most important views in echocardiography. First of all, it's a view where we see very many structures, and then it's also a view from which we can find all the other structures more easily. So I'll show you how to orient the view, and then also which details you can depict. The four-chamber view should be oriented in such a way that the septum is parallel to the ultrasonic beam. It is furthermore important to really check that the atria are as large as possible, because if you're down like this, then you don't have an optimal four-chamber view. So you have to tilt until you really get large atria. And if you do so, you can see the following structures. We have the lateral wall of the left ventricle, we have the septum, we have the right ventricle with a moderator band, we have the lateral wall of the right ventricle, then we have the left atrium, the right atrium, the interatrial septum with the fossa ovalis, we have the tricuspid valve with the septal leaflet, and here the mitral valve with the anterior leaflet, the posterior leaflet. If we want to go into more details, we can even see the pulmonic valves as they enter the left atrium. This is the right upper pulmonic vein, not valve, of course. The right pulmonic vein. Those are the left pulmonic veins, the lower and the upper. And here you would see the descending aorta, the orthogonally orthogonally visualized descending aorta. The easiest way to get to a two-chamber view is when you start out from a four-chamber view. So this would be the four-chamber view. But before you rotate it, before you try to get there, the most important thing is that you have to try to get the ventricle right in the middle. Because when we rotate, we will be rotating around that middle. And if you do not put the left ventricle in the middle, you will be rotating around different structures and not the left ventricle. So now we have the ventricle in the middle, and now I will be rotating without changing the axis slowly counterclockwise, and you will see that the right ventricle gets smaller and smaller, and at the same time you will have to try to assure that the size of the left atrium remains as large as possible. If you lose the size, you will also tilt out of your axis and you will not get a decent two-chamber view. So this is basically just to give you an aid that you're still on track. So you rotate more and more until you finally arise at the two-chamber view where you do not see right ventricular structures. In the two-chamber view, what you will be seeing here is the anterior wall, the inferior wall, the left atrium, and the mitral valve, where you cannot distinguish between anterior and posterior leaflets, simply because you're now exactly parallel to the closure, to the commissural closure line. So how do I recognize that there is foreshortening? Well, the most important finding is that you have a rounded apical shape. You see, the apex is not pointed but round. The second finding is that you have a rather short left ventricle, especially when compared to the atrium. How can you correct this? You can correct it by just moving more apically and laterally. Okay, this would probably be a better view. So this is much less foreshortening. Of course, you cannot avoid that you miss some of the superapical views, but this is certainly better than what you've seen before. If you really need to see the superapical views, there's another trick that you can use, and that is by bringing the patient more in a position on the back and rotating the transducer very, very laterally, and then all of a sudden you will get views which are very atypical, but which do show you regions of the apex that you cannot see with even the optimized 4-chamber view. From the 4-chamber view, from the subcostal 4-chamber view, all you would have to do is you would have to rotate the probe counterclockwise, bisschen einatmen, and then you will get a short axis view of the left ventricle. And now by tilting the transducer either towards the left, you will get more the apical portions of the left ventricle. If you move it towards the right, you will get more the basal segments of the left ventricle. And if you keep on going, you will then get to the base of the heart with the aortic valve in the center and the pulmonary artery with the bifurcation. In the 4-chamber view, it's easy to see the right ventricle. However, very often the quality of the images is not as good as you would like them to be, especially for the right ventricle. There are ways of optimizing this view, and this is by simply moving the transducer more laterally and pointing the transducer more towards the right side of the body, and thereby you have a more perpendicular orientation of the ultrasound beams to the lateral wall, and you have a much better delineation of the endocardium. So this is the view that you can use if you really want to look at the right ventricle and to assess function, size, and further other things.